The Spanish flu and COVID-19 are what we're here to look at today. We're comparing them and contrasting them to see how they really differ and compare in their measures which we are trying to show. So basically, we're comparing the death count and how and why they got to such points that they are at now. So I'm covering scientific understanding of Spanish and the COVID-19. So it starts off with basically there was not very much knowledge to start off with about these two. Well, about the Spanish flu specifically, because the Spanish flu started off and it was during a war, so there was a lack of information, and everyone was like, no, we don't have a virus. We don't have anything wrong with us. Meanwhile, they're all dying from the Spanish flu. And it only really came to the surface when it got transmitted to Spain, which was a neutral country. And they also believed there was a bacteria, so they were just trying to treat it with wholly useless methods. Our knowledge on the disease didn't really sprout till like halfway through the epidemic, and well, we didn't know how to treat it, so that was still a major issue. But we also really didn't have any regulations or measures to protect our people against it, since all of those were developed from the Spanish flu and how the Spanish flu basically damaged the society. The Spanish flu was unlike a lot of predecessing diseases that humanity had, as it didn't really kill until like a good incubation period had passed. So a lot of people died, but a lot of people survived as well. And it basically just spread through that. So people would get infected, not show symptoms, then they would either die or survive but be injured. The seasonal flu strains all come from that one, though. So we have something like that every year. It's just that it's much less mild and we have vaccines to treat it. It's, well, COVID's not over yet, but we still are working on it. There's vaccines being made, there's all types of advancements. We now know that's airborne. We didn't know that before, but it's working. We're getting there. And the end is nearly in sight, some people think at least. And well, a lot of people think it's going to be from a vaccine, but I personally believe that it's more likely that it'll just die out a little bit more slow because we've already been having lowering percentages of people being infected each day. And the hospitals are getting less and less crowded as we're basically making it more efficient to treat and make sure people are fine.
Now moving on to the Spanish flu versus COVID-19 through an industrialization lens. Looking at industrialization before the Spanish flu. The Spanish industrialization, the second industrial revolution began in 1870 and ended in 1914, where innovations in production, line technology, material science, and industrial toolmaking made it easier to mass produce goods. Some of the advances that were seen during the second industrial revolution were rapid advances began in the creation of steel, chemicals, and electricity. Factories began producing sewing machines for home use, steel graters for skyscrapers and railroads were being made, and household items were now being mass produced instead of being homemade. And through an economic lens, the US had its highest economic growth during the last decade of the second industrial revolution. Although it had the highest economic growth, the growth is also unstable. And the world's economy experienced harsh depression in 1873 and again in 1897. Businesses would be in constant battle to gain control of industries such as steel and technology. Looking at industrialization after the Spanish flu. Despite popular belief that the Spanish flu had a direct impact on the economy and almost left no discernible mark on the economy. The Spanish flu, unlike COVID, occurred right after a economic downturn where the Dow Jones Industrial Average, which is a stock market index that measures the stock performance of 30 companies in the stock market, average decreased 21.7% in 1917. And the stock market recovered significantly during the pandemics to where the BO index increased by 10.5% in 1918 and by 30.5% by 1919. The economy eventually led into a recession in 1921. Not to say the Spanish flu had no economic consequence. An example of a consequence would be that the coal output was considerably reduced by the Spanish flu in various states. Looking at industrialization before COVID-19, Donald Trump took office in January of 2017, where he inherited an economy in its 21st month of economic explosion, following the end of the Great Recession of June 2009. That expansion continued into 2020, but being the longest on record, but was ended due to COVID-19. While the expansion was quite long, the economy's average annual growth rate and typical workers' earning gains were relatively modest compared to the earlier long expansions. Trump claimed that his politics would produce a substantial increase in economic growth, but in contrast, the COB, also known as the Congressional Budget Office, and other analysts predicted a much slower growth and smaller increase in most workers' earnings. Now looking at how COVID-19 may affect industrialization in the future. COVID-19 has already been showing a host of challenges to the US industrial manufacturers, especially the ones that depend on workers whose work can't be done remotely. 80% of manufacturers expect the pandemic to have a financial impact on their business. Majority of those manufacturing sectors, which is about 53%, expect COVID to impact their operations. In fact, we've already seen this become a reality, where major industrial companies have already had to close their facilities because manufacturing jobs have to be done on site. And we've seen major layoffs in order to stop the spread of the virus. A prediction that has emerged is that the economic fallout from COVID will be disastrous. Analysts expect a 20 to 30% decline in GDP, which is gross domestic product, for quarter two of 2020, as well as a 15% jobless rate. COVID-19 is taking place concurrently with the fourth industrial revolution. During the fourth revolution, we will merge the physical, digital, and biological works. This industrial revolution will be unlike anything mankind has experienced before. And a fundamental difference between the fourth revolution compared to previous revolutions we've had is that in previous ones, the changes occurred outside the body, but now it will also occur inside the body, possibly redefining us as Homo sapiens. The fourth revolution has the capacity to provide better digital solutions for one's daily life during a crisis.
So now we'll shift to globalization. Regarding the Spanish flu, many sources argue that back in 1918, there wasn't enough information about the economy to really say how much it was really affected by the pandemic. It is said that researchers estimate that in a typical country, the pandemic reduced real per capita GDP by 6% and private consumption by 8%. These declines can be compared with the declines that happened during the Great Recession in 2008. As for the US, the declines were much lower. It was a 1.5% decline in GDP and a 2.1% drop in consumption. The decline in economic activity, combined with elevated inflation, resulted in large declines in the real returns on stocks and short-term government bonds. As an example, we have those countries that experienced the average debt rate of 2%. They saw real stock returns drop by 26 percentage points. The estimated drop in the United States was much smaller, with a 7 percentage points. Now, COVID-19. To say how much COVID-19 has affected globalization, the changes in the workforce, stock market, and major industries since the introduction of COVID-19 in January 2020 were examined. The economic impact of COVID-19 was explored through population and workforce impact based on the 2018 and 2019 database. When it comes to air travel, 10 significant airlines covering over 50 countries presented large coverage in terms of passengers carried. Airlines such as Turkish, Delta, and Lufthansa Group each carried more than 5 million passengers per month in 2018 and 2019. Most airliner countries have responded to COVID-19 by implementing international travel bans from affected countries. On average, about 30% reduction in stock prices has been observed among major airlines. 99.7% of the individuals in South America and 92% of North America are living under travel restrictions, and only 62% of individuals are living under travel restrictions in Africa. In sea travels, we have the Carnival Corporation as an example. This is one of the largest cruise lines companies which carries about 1 million passengers monthly across its multiple cruise lines. The corporation responded to COVID-19 pandemic by suspending cruises from March 13th to April 9th. This cruise line has observed over a 60% reduction in stock prices. In the United States, Los Angeles handled 9.46 million TEU in 2018, and since the pandemic, a reduction in trade volume by over 22% has been observed. Similarly, Long Beach, where over 8 million TEU vessels have been handled, a 17% decrease in imports has been reported. Social distancing, as we know, has been implemented since the pandemic broke out. This has led to the cancellations of many events across the world. For instance, the 2020 Summer Olympics that were to be held in Japan this year was rescheduled for 2021. With the lockdowns and travel restrictions, the workforce has been affected universally. About 62% of global employment constitutes an informal economy characterized by lack of social security, benefits, healthcare access, income security, and remote work, presenting the most vulnerable group. Among the most vulnerable in the labor market, almost 1.6 billion informal economy workers are significantly impacted by lockdown measures. The most affected industries, such as manufacturing, accommodation, food services, and retail, present about 54% employers worldwide and account for 30% of average GDP. It is estimated that a considerable amount of time and effort is needed for these sectors to recover.
Medical technology with the Spanish flu versus COVID-19. In 1918, avian H1N1 appeared, causing an estimated death toll of 50 million deaths worldwide. During these times, there was not a lot of medical technology or pharmaceuticals that could have prevented the high death rate. It is unknown exactly where the particular strain of influenza that caused the pandemic came from, but they first saw the cases in the military centers, because during this same time period, World War I was taking place, making it to spread faster. When this flu started, doctors and scientists were unsure what caused it or how to treat it. Influenza vaccines did not exist at that time, and even antibiotics had not been developed yet. For example, the first licensed flu vaccine appeared in America in 1940. Some cities managed to put upon community migration measures such as closing schools and issuing quarantine orders. As a way to treat this pandemic, doctors prescribed medications that they felt would alleviate symptoms, such as aspirin, which had been around since 1899. In 1919, the flu pandemic came to an end. People who were infected either died or developed immunity. Many years later, researchers discovered what made the Spanish flu so deadly was three genes which enabled the virus to weaken the patient's lung and clear the way for bacterial pneumonia. This gene was called hemagglutinin HAG. This gene did not have a cleavage site, which meant that the surface protein would allow an influenza virus to enter and infect a healthy respiratory tract. Methods such as intensive care support and mechanical ventilations were not available in 1918. Without these medical treatments capabilities, doctors only had to follow rules such as social distancing, wearing masks, and others to see which would result in the best outcomes. We have experienced for the last couple of months a deadly virus called novel coronavirus 19. This virus has killed around 1.26 million of people. Measures have been implemented to stop the spread of this virus. With more modern technology advancing each day, we have the ability to control a pandemic and use the technology to save patients' lives, something we did not have 100 years ago. Some of the medical technology being used to treat this is ventilation machines, oxygen machines, oxygenators, which measures the levels of oxygen in the blood, glucose meters, ultraviolet lamps, temperature monitor, screening tests such as molecular or antigen tests. As for the methods used, was by implementing quarantine measures, social distancing, wearing masks, and wearing special gear for protection. Knowledge from past pandemics has helped us use similar tactics to control the rate of infection and not have as much death rate worldwide. Technologies has also helped people to stay alive and overcome this deadly virus, something we did not have 100 years ago. Today, considerable advancements have been made in the areas of health technology and medical care. Flu vaccines are now produced and updated yearly, and yearly vaccination is recommended for everyone 6 months of age and older. All of these investigations can be done by the great use of microscopes, which is also a type of technology. Medical tech helps us to investigate that someone can be infected with the virus for 2 to 14 days before they feel sick, and some people may never feel sick. As we all wait for the potential vaccine to treat COVID-19, scientists need to find out what the virus contains. Like, for example, many years ago, they weren't aware that the virus contained that, that the virus did not process a cleavage site mutation, which is a recognized genetic code for the severity or harmfulness of a disease. Now that we have the technology to see what strain, mutation, and the virus genetic information, we'll be able to find out and see how to attack it.
So now I'll be focusing on geopolitics for the Spanish flu and COVID-19. Geopolitics, the Spanish flu. The 1918 Spanish flu pandemic was a deadly virus that was able to make its way across the globe. During this time, the world was also facing its First World War, and unfortunately, that event led to this disease spreading even more rapidly. As soldiers were being moved across different countries, it resulted in a major spread of the disease. Overall, the entire military industrial complex of moving men and material in crowded conditions was certainly a huge contributing factor in the ways the pandemic spread. To make things even worse, despite the fact that this disease was spreading like wildfire, the government's response overall in various countries was very poor. Even though government officials did advise their people to wear masks throughout the day, soldiers were still sent out to fight and continue the war. For example, health officials on both sides of the Atlantic refused to take the necessary precautions needed in the first few months, which almost certainly allowed the second strain to evolve. British government leader Arthur Newsom, along with his other colleagues, understood that quarantine was the most effective way of preventing an international crisis. However, he strongly believed that going to war justified incurring the risk of spreading infection, and as a result, encouraged the government to carry on as normal. Lastly, even though the Spanish flu ended up costing the lives of 50 million people, this event served as a lesson for when it came to global health governance, as it led to the creation of the League of Nations Health Organization, which later became the World Health Organization, also known as WHO, in 1948. Fast forward to 2020, the world is now dealing with a new pandemic, COVID 19. Just like the Spanish flu, COVID has spread rapidly throughout the globe, infecting millions of people. During this time, global politics stand threatened by increased tensions, blame game, and finger pointing, especially between the United States and China. The US squarely blames China, especially since the virus originated from there. The Trump administration blamed China, particularly the Chinese Communist Party, for the COVID 19 pandemic that surfaced in Wuhan at the end of 2019. And in return, China has accused the United States of mismanagement and failure to take the pandemic seriously. Overall, despite the fact that global tensions did increase, leaders and health systems around the world were able to act accordingly when it came to responding to the increased need of help from people affected. Countries across the globe have been able to come together and help each other as much as possible with sending medical supplies and other personal protective gear. For example, Russia was able to send military and medical aid to Italy on planes at a time when most European Union countries and other traditional partners have failed to provide the help requested by the Italian authorities. Turkey also ended up doing the same for countries in Europe and also the United States, while the while the- while the number of cases amongst the Turkish population are still on the rise. Lastly, governments have also adopted a wide range of containment measures, which has resulted in the shutdown of manufacturing as well as labor disruption through enforced isolation, travel bans, and border controls across the world. In the last few months, international travel has been brought to a standstill. All of Italy is currently under a nationwide quarantine, and Donald Trump has declared a national emergency in response to the pandemic. The response in America, as in much of the world, has been the same by issuing government restrictions on large gatherings, and states like New York have mandatory containment zones. In conclusion, due to many of the discussed reasons, the spread and death count of the Spanish flu were much greater than that of COVID-19 so far.